And welcome to Learning Unit number 11. In Learning Unit number 11, we're going to be talking about pain and symptom management at end of life. And we're going to be looking at the ethical principle of the double effect. So adding that on to our other ethical principles that we have been reviewing throughout the weeks. So first of all, you're watching this video, and then as always, our topic description, the objectives, the learning activities and assessments are as follows. So we're looking at pain and symptom management at end of life. Specifically, we're looking at palliative, sedation, and we're reviewing some of the basic skills for conversations about end of life care. So by the end of this learning unit, you're going to be able to understand what palliative sedation is, how it differs from euthanasia. We're going to be able to, through the quiz, even take some questions that ask us about caring for patients at end of life with unrelenting pain. And then we're going to look at, again, the ethical principles, and our learning activities are going to be as follows. So I'm going to just explain them here first. You're going to be reading the Holistic and Palliative Nurses Association. So that's what this stands for, the Holistic and Palliative Nurses Association. They have a position statement entitled Palliative Sedation. And yes, it's readings. I know a lot of you, based on the evaluation of how the course was going at midterm, said less readings, more videos, but this is really important readings. So I ask that you take the time to read through this. And then there will be an article on pain management at end of life. There is a video on the double effect, and you're going to be taking quiz 11. Quiz 11 is specifically going to test your knowledge about the palliative sedation position statement and the principle of double effect. So you're getting this mostly from the video, and you're getting this from the article. You're going to experience a humming meditation. And you're going to let us know in the discussion board how you even felt about doing this humming meditation. What's really cool, I guess is the word, is this was developed, and the video is on one of our graduates of our Master's in Nursing program. So Sarah did this humming meditation, and she had the meditation and her article on this published. And we're going to do this instead of Smiling Mind. It seems like Smiling Mind hasn't been you're not all a fan of Smiling Mind, but I thank you for continuing, because we will continue with the Smiling Mind app in future learning units, but I wanted to give you a different flavor than using your Smiling Mind app for this class. And you're going to complete the discussion board posting. You're going to do the post by Friday evening, and you're going to reply to one of your classmates' posts by Sunday evening. I am working with the instructional designer to also get a request in based on that evaluation at midterm, so that you see a different date for the post than you do for the reply. So you should be notified, or at least notified if you're late in doing one or the other. So in the past, it's been, I could only put in one date for your discussion board post. So I would put it in on Sunday evening as the date, but then that didn't alert you to the fact that your original post was due Friday evening. So I hope that makes sense, but basically these are the instructions. So let's go on. And I just want you to all know, because we have looked at 5 wishes, and April 16th is National Healthcare Decisions Day. Every year, it's going to be April 16th. So we honor National Healthcare Decisions Day because it is an initiative nationwide that encourages all adults of all ages 18 and above to plan ahead of a health crisis. This is the advance directive that we have spent time with. So I just think it's kind of cool that every year on April 16th, they do have this Healthcare Decisions Day. So you don't have to do anything more with that, but click on and read it. This is the holistic and palliative nurses position statement. I was trying to get the updated 2025 version, but there was a charge of $45 for it. I was able to review some of it, and it didn't look like it dramatically changed. So if I can get that 2025 version before this course opens, which now, or this learning unit opens, which now it's opened bright and early Sunday morning instead of Monday, another request that was made. So if I can't get this, or if I can get the updated version, I will post it. But otherwise, you can read through this position statement as is. And I think it was 2018 when it was last updated. So then there is an article on managing symptoms at end of life. So yes, it is a bit heavy in readings as far as you've got these two readings, but they're very important. So please take the time to do it. Then there is a video on ethical considerations for double effect. And it's a 4-minute video that really explains pretty well the double effect. And that's an important ethical principle for you as nurses to know. This will be something that you will come back to in your clinical practice. Quiz number 11 is NCLEX style questions. I know they're a little tougher, but I ask you to take your time and look through it. You have up to an hour to complete this quiz, but you do have to complete it once you click on. So what it is testing again is the double effect video and the HBNA statement, policy statement on palliative sedation. Just those two things. It is not looking at necessarily this information. It's not testing on that information. This information, managing symptoms at end of life, it's going to be reflected, your knowledge will be reflected on that article in the discussion board. So before I get to the discussion board, here is the humming meditation by one of our own MSN, now graduates of our program. So please enjoy that. Now, discussion board 11, if we look at that, there's 2 parts. You are going to do both your post and a reply, as I said earlier, to one of your classmates. So there's 2 questions that you're answering. Summarize and cite the key information learned from reading the article entitled Managing Symptoms at End of Life. And I also want you to share your experience with the humming meditation. And that will be our discussion board, and that will tie us up and finish off this learning unit. So there is important content, but if you take your time in reading the article Managing Symptoms at End of Life and reading that position statement on palliative sedation, you should do very well on the quiz. And then the quiz is also based on the video of the double effect. So happy National Healthcare Decisions Day.